20 million people a year, 10% of adults in the United States, suffer from some form of permanent damage to their kidneys. When we think about what we're drinking and eating, we don't really think about the harm we're causing our own body until it's usually too late and we need to see a doctor. Diabetes is the most common cause of ESRD, or what we call end-stage renal disease, according to kidneyfund.org and kidney.org, where all this information can be found. UTIs, along with genetic diseases and autoimmune diseases, are secondary ways that this disease and damage can be caused to your kidneys. People get UTIs and they go and they take medicine and they drink their cranberry juice and they think the pain is gone, so I'm good. But they don't ever think about the type of damage that could have been caused to their kidneys. Acute kidney injury also is a form of damage that is usually not permanent, but happens within 2 days on a usual basis, not a regular basis, I should say, that is caused by some form of injury. This could be an automobile accident in which you lose too much blood, if you are shot or stabbed or some way that would cause your body to lose too much blood. Your kidneys could shut down in failure, in which you'll receive temporary dialysis to clean all the toxins from your body, and then the kidneys can take a little bit of resting period in which they can heal themselves back. When I say heal themselves back, your kidneys don't usually heal themselves when you have permanent damage done to them. But as I said, acute kidney injury is not permanent. These people that are affected by this kind of permanent damage, they lose their lives, they have extra stress, and most of the time they can't work. They have to receive dialysis. Dialysis can be 15 hours a week or more, and a dialysis treatment is up to $2,000 a treatment. These people who can't work because they're spending 3 or 4 hours a day, 3 to 4 times a week in a dialysis center, can't get insurance. There are many ways that money can be raised for them. I worked at Freeman Hospital as a dialysis nurse, and Freeman Hospital is a local organization that puts on a walk called March of the Kidney, and you can usually find it on their webpage around the time of March. They, in previous years, have held it at North Park Mall. They charge, in previous years, $10 a walker. You go, you walk, you get to visit with the people who live this life and see how your money will be spent helping them with their daily needs, with their medical bills. The permanent damage that is done to your kidneys is life-threatening. You can't live without either kidney. There are ways that you can help besides donating money. More extreme ways, you can live with only one kidney. If your family is not affected by diabetes or genetic disorders or autoimmune disorders, you can donate one kidney and still live healthily on the other kidney. You can also sign yourself up to be an organ donor. Usually when you get your driver's license, they ask for this type of thing. And when you are no longer in need of your organs no more, you could save someone else's life, make their life easier for their children and their family by giving your kidneys to somebody who can use them. Kidney damage doesn't just happen to older people who have done damage to their kidneys themselves. As I said, genetic diseases and autoimmune diseases. So you can be born with kidney failure and need help from the kidneys of other people who may not need them. This is a picture of what your kidney looks like. Lots of people don't realize they look just like little beans, but you do have 2 of them, and you can live without one. So please check in to if that's an option for you, to give one of your kidneys to help somebody else. This is a t-shirt from the March of Kidneys, from which I worked there, and I got my family and my children to walk and to donate money and to see that there is a life for these people that's not that of, oh, I'm kind of sick, my organs don't work, so I need to go to the doctor sometimes. It is a lifestyle for them. It affects how they are able to eat and how they're able to drink and the time of lifespan that they have left. As I said earlier, the kidneyfund.org is a place where you can find out plenty of information, along with just kidney.org, which can explain to you side effects, causes, and how you could be affected by a kidney disease. And I urge that everybody checks out the March of the Kidney Walk. It's just a walk like for any other organization in which you donate a little bit of money and you get to meet the patients and the people that this permanent damage has affected. It can not only change their life, but it can also change your life, how you take care of yourself, and how you see family members who may be affected by this disease.